Good morning, ladies and gentlemen. It's my pleasure to be here. Today, my topic is contrast-enhanced ultrasound in the diagnosis of severe acute pancreatitis. My name is Luo Yan, come from West China Hospital. SAP means severe acute pancreatitis. My topic will be three parts. Why choose SAP? What is SAP and how to diagnose SAP by ultrasound? First, why SAP? As you know, acute pancreatitis is quite common in acute abdomen. Among the acute pancreatitis, there is one kind AP as SAP. SAP account for 10 to 20%. But the mortality of the SAP can reach 20% to 40%. So, it's very important to recognize SAP from AP. Clinically, when a patient was suspected as acute pancreatitis, the clinical physician usually wants to know, is the patient acute pancreatitis? What is the etiology of the acute pancreatitis? What's the severity of acute pancreatitis? It is mild AP or severe AP. As shown in the picture, here is mild AP and here is the severe AP. The clinical intervention is quite different. The fourth, we want to know, is there any local complication? The picture shows you the local complication. Among the complications, some of them need further intervention. So for acute pancreatitis patient, the clinic want to know, yes or no, the etiology, the severity, and the local complication. These four aspects compose the completely diagnosis for acute pancreatitis. According to the guideline of EFS-UMB in non-hepatic application of CEUS, CEUS is very important in acute pancreatitis, especially in severe AP. It can find the necrotic area in AP. It can follow up AP to reduce the CT examination. It can predict the severity of acute pancreatitis, including severe index, extent of necrosis, and BASA grade. But this view has not been recognized by a lot of physicians or even by the radiologist or ultrasound data. So that's why I choose this topic. The second, what is SAP? There are several criteria. The pathology criteria. There is necrosis in pancreas or and polypancreatic tissue. The clinical criteria. There are organ failure or complications. The contrast-enhanced CT criteria. There is no enhancement of pancreatic parenchyma and or there is no enhancement in polypancreatic tissue. As you know, contrast-enhanced CT is very useful in diagnosing AP. It even becomes the golden standard diagnosis criteria. According to the CT diagnosis criteria, there are two key points. One is there is no enhancement of pancreatic parenchyma. The second key point is there is no enhancement in polypancreatic tissue. The no enhancement in polypancreatic tissue means ANC or WON. Both ANC and WON are local complication. Now, let's move to local complication. There are several local complications according to the onset of AP, and if there is necrosis, the complications are divided into 4 groups. Within 4 weeks, without necrosis, it is APFC, acute pancreatic fluid collection. Without necrosis, after 4 weeks, it is PPC, pancreatic pseudocyst. With necrosis, within 4 weeks, it's ANC, acute necrotic collection. With necrosis, after 4 weeks, it's WON, it's wall of necrosis. The red front means necrosis. The ANC and the WON means severe AP established. This table is quite important. Now, let's move to the third part. How to diagnose severe acute pancreatitis by ultrasound. Similar to contrast-enhanced CT, there are 2 key points for ultrasound to diagnose SAP. The first key point is to find is there any necrosis in pancreas parenchyma. If yes, what's the range? Less than 30% or more than 50%. The second key point is there any local complications? If yes, where and what? Now, let me see the first key point for ultrasound to diagnose severe AP, to find if there is any necrosis in pancreas parenchyma. The upper image shows you the normal pancreas, the normal enhancement. The below image shows you the necrosis within the pancreas. Is very, very clear, but it cannot be seen in 2D ultrasound. So, contrast-enhanced ultrasound can reveal the necrosis in pancreas. The second key point is to find if there is any local complication. As we mentioned above, there are 4 kinds of local complication. The first is APFC. It's usually homogeneous, it's multiple, it emerged in retroperitoneal fissure. It does not require intervention. It has no cyst wall and within 4 weeks. The left image shows you the APFC in omental sac. The right image shows you the APFC in the right perirenal space. The perirenal space, like the green arrow indicate. The right anterior perirenal space, like red arrow indicate. The second local complication, PPC. The most important thing is PPC is quite rare. It's mostly caused by the pancreatic duct rupture or leakage. It's without necrosis of pancreatic parenchyma. It has a clear cyst wall and no solid components. It's quite rare. It's quite rare. The third complication is ANC. the acute necrotic collection. It's within 4 weeks. It means SAP is established. It contains necrotic tissue within pancreas or in polyperimetic tissues. It can be multiple, and it can be separate, and it also can be secondary infection. The left image shows you the ANC in omental sac. The right image shows you the ANC in perirenal space. The green arrow indicates the left perirenal space, and the right arrow indicates left anterior perirenal space. The fourth local complication, WON, it formed after 4 weeks. It has a clear wall and composed of necrotic tissues. The left image shows you the WON in omental sac. The right image shows you the WON in left perirenal space. Once the ANC or WON was found, it means this patient is severe acute pancreatitis. All of these 4 kinds of local complications can be defective, especially ANC and WON, but it is difficult to judge the infection only by image. Up to now, we have discussed the role of contrast-enhanced ultrasound in diagnosis acute pancreatitis. It can find the necrotic area, and it can judge the local complication. Furthermore, the contrast-enhanced ultrasound can evaluate the severity index. The severity index can be judged by both contrast-enhanced CT or contrast-enhanced ultrasound. The SI composed of 2 parts. One part is CT grade or ultrasound grade. According to the number or the scale of polyperimetic fluid collection, the grade score is 4 points. The second part is the necrosis score. According to the necrosis, the percentage of the necrosis, the necrosis score is 6 points. The total point of the severity index is 10 points. If the total score is 0 to 3 points, it is a mild acute pancreatitis. 4 to 6 means moderate acute pancreatitis. 7 to 10 points means severe acute pancreatitis. So, contrast-enhanced ultrasound can find the necrotic area in pancreas, can determine the local complication in polyperimetic tissue, and can evaluate the severity of the index. At last, let's move to conclusion. The conclusion is just a recommendation of EFS-UMB guideline. CUS can be used to diagnose and follow up severe acute pancreatitis. To diagnose means CUS can recognize SAP from AP. To follow up means CUS can provide more information about local complication and the severity of acute pancreatitis. Thanks for attention.